Controversy 7. Should people have the choice to end their lives? There is a legal battle going on in America right now over whether or not a person has a right to die. About a decade ago, news were made by the case of Terry Schiavo, a woman who at that time was kept alive artificially for over 13 years, even if doctors agreed that her state was a persistent vegetative state. Such state refers to a condition in which a person is technically alive but the brain is dead. So the news were made due to the government denial for a death with dignity for Terry, which sought by her husband in accordance with Terry's wishes. The question was, does the government have the right to prolong your life by artificial means, whether you desire it or not? And from here, our question today, should people have the choice to end their lives? Accordingly to our textbook, more than 2/3 of all deaths in the United States occur among people over age 65. End-of-life choice, it's quickly becoming our decision to take regardless we like it or not. And that is because the medical advances force us to make decisions unforeseen just a few decades ago. Procedures of resuscitation, artificial breathing machines, or artificial nutrition aim to keep the human body alive even when there is a dead brain. What would you propose in such cases? From the medical standpoint, or how about from the family standpoint? When it's time to terminate life-sustaining treatment, the decision is taken based on the individual understanding of euthanasia, which as a term comes from the ancient Greek meaning simply good death. Active euthanasia, which denotes some deliberate intervention to end the patient's life, such as giving a fatal dose of pain-killing medication. Passive euthanasia, which is not doing something, such as withdrawing life support therapy or unplugging the life support apparatus. And then there is assisted suicide, in which a doctor or family member actively provides the means or carries out the instructions required for an individual to end his or her life. With euthanasia or assisted suicide, a lot of debates have been circulating, one being related to depressed elders and suicidal acts. Depression is a serious diagnostic and should not be overlooked. But just because someone expresses a wish to die, it's not an enough reason to be administered the lethal injection. Moreover, when depression is difficult to diagnose. Several common predictors of suicide include the following: intolerable psychological pain and frustration, a feeling of hopelessness or helplessness, communicating the intent to kill oneself. So what depression means? The clinical depression differs from the down state that it's a common response to setback and can be difficult to diagnose because it can manifest with a variety of symptoms such as insomnia, fatigue, inability to concentrate, anxiety, and other physical or emotional discomforts. The majority of older adults do not feel sad or unhappy most of the time. Researchers have found that many older adults believe old age is the happiest period in their lives. So when an older adult might express the wish to end life, for doctors can be difficult to determine whether an older adult's rejection of life-saving treatment is an informed choice or a sign of depression. Depressed patients are more likely to refuse procedures in situations where the medical prognosis is actually good. Doctors are committed to keeping patients alive at all costs. The attitude of treatment at all costs may not respect someone's decision to end his or her life, just like in the case of Terry Schiavo. Widespread public discussion of the ethics of death and dying began during the late 60s when the first major right-to-die case, which involved Karen Ann Quinlan. Karen Ann Quinlan was 21 years old in coma, connected to ventilator. When family requested court's permission to discontinue the ventilator usage, the New York Jersey Supreme Court ruled that there was a constitutional right to privacy to allow withhold or withdrawn life support treatment. And with the right to privacy, California took a step further and passed the first important right to die law in the year of 1976, calling it the California Natural Death Act. Under common law in the United States, people have a basic right to accept or reject medical treatment. In many U.S. states, this constitutional right to refuse treatment can be exercised by another person on behalf of someone who has been deemed legally incapacitated or incompetent. Where no family member is present, courts have relied on guardian ad litem, who is a designated spokesperson who represents the interest of an incapacitated person and reports to the court. Moreover, courts rely on two kinds of standards to determine when to withhold or withdraw life-sustaining treatment. One is the standard of substitute judgment, in which the central question is, what would the patient have wanted under the given circumstances? And the other standard is called best interest standard, which asks, what is the balance of benefits and burdens that a reasonable person might want under these conditions? The evolution of right to die laws created advance directives, which are legal documents such as a living will or power of attorney for healthcare instructions. The first state to permit physician-assisted suicide was Oregon, then Washington, Montana, and Vermont followed Oregon. But in most jurisdictions in the United States, assisting a suicide is a crime, regardless how many times the court underlined that termination of life-sustaining treatment is not homicide or suicide. Americans lack a clear consensus about exactly how dying well might be defined. At a minimum, dying well typically refers to having the right to know one's medical condition and the choice to accept or reject life-prolonging treatment. But whatever the outcome of the public opinion in regards to end of life, older adults are taking matters into their own hands. Statistics show that older adults are more likely to attempt and complete suicide than any other age group. So what about the other countries? What is the outlook for the future? End of life is a widely discussed topic. In Europe, the Netherlands has gone the furthest in legalizing euthanasia and physician-assisted suicide. But critics of assisted suicide and euthanasia believe that we should focus more on palliative care, such as hospice and better pain medication, rather than jumping to give or receive the lethal shot. A major step involved in end-of-life decision came with Patient Self-Determination Act in 1991. This law requires hospitals, nursing homes, and other healthcare facilities to advise all patients at the point of admission about the right to accept or refuse medical treatment. While reading Why Do People Seek Physician-Assisted Death, focus and try to critically observe Through your reading, some of the insights authors gain from conducting their longitudinal study of patients who seriously pursued assisted death. In reading 31, the author states, quality of life to the last and control over the circumstances of dying are issues that touch everyone, and assisted dying will become legal and accepted when the public wants it to be. And in here, a great debatable question is, do you agree or disagree that assisted dying will become legal when the public wants it to be? Reading 32 tells a compelling story. After reading it, ask yourself what are the major impressions to take away from Last Right's Auntie's story by Woodman. Cass begins his essays with the question, may or should one kill people who ask to be killed? What are your thoughts in response to this question? Think from various standpoints, caregiver, physician, or spouse. And that is all for this lecture. This recording is best used in conjunction to your textbook and other assigned videos or readings when the writing assignments for this week are completed. Thank you.